Why are we taught as nurses to educate our patients to monitor their glucose when they're taking glucocorticoids? First, glucocorticoids are steroids. They're typically given to patients to reduce inflammation. However, these medications can actually cause hyperglycemia in both diabetic and non-diabetic patients. And they do this in two ways. Glucocorticoids are going to promote gluconeogenesis in the liver. So if you think about that word, gluconeogenesis, gluco, sugar, glucose, neo means new, and genesis, we're going to create. So we're creating new glucose. That's what our liver does. And glucocorticoids promote this. So they're increasing the amount of glucose the liver is releasing to the body. They also antagonize that insulin response. So what that means is it's going to decrease the insulin response. So now, if we don't have insulin in the body, but we're releasing more sugar, we're going to have a higher blood sugar. Remember, our cells need insulin in order to uptake that glucose from the bloodstream. Insulin is like a key. Without that key, the cells cannot utilize that sugar that's in the bloodstream. Our non-diabetic patients may be able to easily handle this slight increase in blood glucose, but our diabetic patients we need to be very careful with. They probably need to adjust their insulin levels that they give themselves to accommodate this increase in blood glucose when taking glucocorticoids. We also need to remember that high blood glucose on a regular basis can increase our patient's risk for infection. Tell your patient to monitor for signs and symptoms of hyperglycemia. This is going to be things like exhaustion, tiredness, fatigue, excessive thirst, excessive hunger, urinating frequently, and of course, checking their blood sugar regularly or more often. If this was helpful, go ahead and hit that follow button and save for more Farm for Nurses.